Had you also gone for? Here was some routine as much sports. मैं अभी वही जो chairman should have rules and regulations being right, but
not making up
Hello, Saya नाम सुना है? तेरे को सुना? शाम का नाम? कल से शाम की?
Assalamu alaikum, ladies and gentlemen. I, on behalf of the organizing committee, welcome you all today on the World Health Day to the seminar on healthcare in the new millennium, and also to release a book on hospital and health services administration by Dr. Syed Amin Tabish. Both subjects are not only pertinent on this day of April, but are also important for a nation already within the portals of the new millennium. Let us use this day and occasion to rededicate ourselves to providing a better healthcare for our poor, our needy, our sick. Let us rededicate ourselves, ladies and gentlemen. उनके लिए वो जिन्हें दावे करा वाली अय्याम नहीं, उनकी पलकों पे शबो रोज को हल्का कर दें, जिनकी आंखों को रुके सुबह का यारा भी नहीं, उनकी रातों में कोई शम्मा मुनव्वर कर दें, जिनके कदमों को किसी रह का सहारा भी नहीं, उनकी नजरों पे कोई राह उजागर कर दें. And now, without much further ado, I'd like to invite Dr. Shaukat Khan to present the welcome address. Thank you.
Honorable Chief Guest, Dr. Mustafa Kamal, Vice Chairman Governing Body, Dr. Muhammad Ali Mattoo, Director, Sher-e-Kashmir Institute of Medical Sciences, Professor Merajudin, Dean of the Medical Faculty, Professor Jalal, Head Department of Hospital Administration, Professor Qadiri, distinguished guests, faculty members, Organizing Secretary, my dear residents, ladies and gentlemen. I, on behalf of the Organizing Committee, welcome you all on World Health Day to this seminar on healthcare in New Millennium. In the 2000 years that have gone by, mankind has witnessed monumental breakthroughs and achievements in the field of healthcare made possible through outstanding contributions by extraordinary men like Hippocrates, Leonardo da Vinci, Ibn Sina, Joseph Lister, Alexander Fleming, Curie, Robert Koch, Edward Jenner, Watson and Crick, Roentgen, Christian Bernard, Hounsfield, and others. From diagnosing a disease by pulse, temperature, color of eye, and status of tongue, we have reached the modern era of evidence-based medicine, possible through revolutionary, innovative, and state-of-the-art cutting-edge technologies involving X-rays, radioactivity, immunoassay, polymerase chain reaction, Western blot, electron microscopy, laser, computerized tomography, magnetic resonance imaging, positron emission tomography, and lately, the most significant, human genome mapping and cloning. Mankind is on the threshold of entering into an era of highly specific molecular diagnosis and target-specific designer drugs. The advances in availability of information technology has made unimaginable impact on healthcare in all its spheres and dimensions. Ladies and gentlemen, we as Homo sapiens have every right and reason to feel proud of our achievements. However, it's quite distressing and painful to realize that the benefits of these achievements and technology have not reached a significant proportion of the world population, especially in the third world, the rural areas, socially deprived and economically weaker sections of society, the underprivileged, and other vulnerable segments of our population. We need to sit down and deeply introspect the past and find out where did we go wrong. What happened to the high-profile UN-sponsored program of Health for All by 2008? Why do we have concentrated and vertical growth of healthcare facilities in metros and cities only? Why are sick patients treated as commercially attractive commodities? Why has this noble profession transformed into a high-profile economical activity? Why have we failed in implementing the primary healthcare concept? And what happened to that hidden touch? Healthcare needs to be taken seriously as a challenging agenda and not a mere social obligation or political compulsion. The government has to increase the budgetary allocation to almost 5 to 6% of the annual GDP. An integrated and comprehensive program needs to be formulated, which must include education, building of infrastructural support systems of roads, sanitation, clean water supply, agriculture, telecommunication, information technology, and environmental protection. If we are to realize our dream for health for all in this millennium, we have to find ways to reduce greenhouse emissions and control global warming. Urbanization and industrialization have to be undertaken carefully without disturbing the delicate ecosystem and environment. Ensuring global safety and security would leave a lot of time and financial resources to implement the healthcare project and would lessen to a great extent the miseries of war, especially on the delicate, fragile segments like children, women, the old, and the sick. Research, teaching, and training are basic to healthcare. It helps us to understand the biological basis and natural history of diseases, and generate statistics which are eventually useful in healthcare planning. Teaching and training are also important for developing an optimal quality healthcare manpower. In this era of information technology, the basic tools of research and teaching have undergone a sea change and brought about nothing short of a medical revolution. We must create a work culture where we have free and quick access to these facilities. The academic infrastructure in our institutions needs to be further strengthened. Our libraries need to be upgraded and equipped with modern tools of information, providing online access to world medical literature. They must have cyber counters and, of course, reasonably longer time. The authorities must encourage scientific endeavors with liberal economical assistance and logistic support. Let's hope that in future, tertiary care teaching institutions like Srinagar Institute of Medical Sciences have their own internet service. In the current millennium, we would see eradication of infectious diseases, decrease in the prevalence of chronic disorders, and ultimate cure for cancer. We hope to have an effective vaccine against AIDS, have lesser number of children dying of malnutrition, and we hope to achieve a drop in the infant and maternal mortality rate, and a decrease in the number of man-made disasters through proper planning and environmental protection. Ladies and gentlemen, a strong political will, an enthusiastic bureaucracy, and a dedicated healthcare manpower would, I'm sure, by the grace of Almighty, fulfill our dream of healthcare for all. Let's not avoid our people in remote villages, because that is where they need us the most, and that is where the major health-related problems exist. We must not miss or lag behind in the race to tap technologies for better health care. We must build expertise to take advantage of the Human Genome Project, as we are uniquely positioned to reap a windfall from genomics. In the present difficult economical situation, the thrust should be on preventive medicine. On this occasion, the organizing committee would like to congratulate Dr. Syed Tabish for an incredible and unprecedented achievement of having authored a textbook on hospital and health services administration. Dr. Tabish, you have done all of us proud and brought glory to Shaykh Institute of Medical Sciences. On behalf of the organizing committee, I would like to extend a warm welcome to our new batch of young postgraduates and wish them all the best in their pursuit of knowledge, skill, and technology. Ladies and gentlemen, we have chosen some of the best experts in their respective fields to speak in the scientific session. The theme of the seminar is healthcare, so the topics chosen are broad-based and general. The organizing committee sincerely hopes that the deliberations will be useful and interesting. With these words, I wish to conclude. And before doing so, I once again, on behalf of the organizing committee, welcome you all to this seminar. Thank you.
Thank you, Dr. Shaukat. Truly indeed, a dedicated manpower is the most important asset of a nation. As Allama Iqbal has aptly said, "Agar hai jazba-e tameer zinda, to phir kis cheez ki hum mein kami hai." To continue with our program, I now invite Dean Medical Faculty, esteemed Professor Jalal, to say a few words.
Honorable Minister for Industries, Sheikh Mustafa Kamal Sahab, Vice Chairman Muhammad Ali Mattoo Sahab, Honorable Director Professor Merajudin, Professor Jalal Qadiri, Amin Tabish, and dear friends and colleagues, we have assembled here this morning to celebrate the 53rd anniversary of the World Health Organization and to review what achievements World Health Organization has made during this half century, and what has been left undone, and what were the reasons that were there that goals could not be achieved. WHO has been the torch bearer for the global health, undoubtedly. Giant strides were being made during the past half century, and new millennium will bring its own challenges to the doings of WHO and the worldwide healthcare people. The human health has probably improved more over the past 50 years than in the past 3 and 4 millennia. Stunning achievements have been made and which are never to be repeated, and we pray and hope that these achievements are irreversible. Despite the devastating effects of the poverty in the Latin American and Southeast Asian countries, which have been made and added further by HIV and AIDS, the human health will continue to improve, but dark clouds threaten to blot out the sun from this landscape. Why there have been some problems? What World Health Organization has achieved, that is tremendous. And what it has not achieved, we may come to know only by a small data from the Southeast Asia. The countries have shared their interest during this half a century in protecting the health through international cooperation. This cooperation started right at the beginning of the 18th century and intensified immediately after the Second World War because of its own compulsions. WHO established in 1948 has done everything along with the UNICEF, along with the UNO for the promotion of health at the international level. And it will have to go ahead lot for doing further. What it has not been able to achieve, the challenge is to make, number one, the pregnancy safer. It is a physiological process, not a disease process. But to the shock and surprise, the data in 2000 shows that 1/3 of all deaths in the adult women are due to the reproductive health, against a very small number in men. Pregnancy-related deaths constitute the leading cause of death in women, and women have the 20 times higher chance of dying in their adulthood, and it is related to the only pregnancy. Southeast region has, which includes our subcontinent, also has 40% global maternal deaths, which is a shocking to every one of us. And childhood mortality among the girls is also much higher than what it is in the rest of the globe. Infant deaths occur mostly, that is greater than 50% in the neonatal period, and 2/3 of the neonatal deaths occur within the first week because of the maternal health problems. Women outnumber the men in this region, that is 94 women per 100 men, and this is a ratio which is quite against in the western and highly developed northern bloc, where 106 and 170 women for against 100 men. Malnutrition is a consequence of a great poverty state of the Southeast Asia region and Africa. 100 million of human beings go hungry on each day, and 30% of the world's poorest population live in this region only, and they have less than $309 per year. 1/2 of the population of the world lives on less than $2 per day, and 1/4 lives on less than $1 per day. What WHO can do for all this? And compare their agony of the health, where from they will get the cost-effective obstetric and the general health care. The scientific and technological problems have not been reached as mentioned prior to me here, to the children, to the poor people. The 40% of the global maternal deaths, that is 585,000 die usually in this only year of 20,000. Most of the women don't have access to their medical treatment. The Southeast region has 38%, that is 8 million tuberculosis, and shocking against within this range also, it is the poor women who are suffering. They have the higher fatality rate because of the tuberculosis. 70% of our children die left under the age of 5 years. In this region, the commonest diseases are, which have been controlled 4 decades back, they are the infectious diseases. And the 40% of the worldwide mortality, that is, occurs only in this region. The women have been disproportionate, children and women have disproportionately suffered for it. Now, what is the WHO's achievements? What it wants to do in the next millennium? The death rate will drop from 34% to the 15% from the communicable diseases, but its challenges to it will be that non-communicable diseases will arise from 50 to the 45 to the 73%. And it will be unfortunately mostly in the developing countries. The burden of the diseases like psychiatric diseases will again go to higher up in the underdeveloped countries. And the pattern of the diseases will shift from pneumonia, diarrhea, and perinatal mortality to the cardiovascular disease, depression, and traffic accidents. It has also, WHO done a lot to achieve the carcinogenic pattern of the diseases. Now, what it is going to achieve in the next millennium by the bioengineering, by giving the artificial hearts, by doing the transplants where the recipients will not be and neither the donors will need that much of problem. It will be the hearts will be given from the animals and from the artificially prepared hearts where there will be no control by the or no control will be needed for the follow-up. It will also take an enormous toll on the drugs where there will not be they will be tissue specific, where the drugs will counter the reactions of the donor. This millennium will see a new challenge as far as the imaging pattern of the disease is concerned. Though there will be an epidemic of the diabetes, there will be an epidemic of the obesity. The diabetic population will go to 300 million by the 2025, and there will be almost 1.8 billion people smoking during this year. What will be the devastating effects of this? Therefore, in the next millennium, the World Health Organization, the health workers, irrespective of their status, have to do a lot to achieve, and unless and until the poverty part is taken care in these regions, there will be problems will be there. But there is no hope to come over these problems unless the governments in these regions control the poverty, unless the governments in these regions take care of distribute their national income towards these areas. Compared to the USA where it is 14% GDP, our country it is 8.5 only. Are we able to cope with the requirements of a 1 billion population by 2030 or 2025? Absolutely not with these. The policies have to be reviewed, and we pray that we deliberate during this period the challenges which we have to face by 2030, and we will make policies to come over these problems and have a better health for these downtrodden section of the society. Thank you.
Thank you, sir. I now request our director, Professor Merajudin, to address the audience.
Assalamu alaikum. Dr. Sheikh Mustafa Kamal, Honorable Minister for Industries and Commerce, Dr. Mattoo, Vice Chairman Governing Body, Shariq Commission for Medical Sciences, Professor Jalal, Dean of Medical Faculty, Professor Qadiri, Head of the Department of Hospital Administration, Organizing Secretaries, distinguished faculty, residents, staff and guests. I take this opportunity to extend my warm welcome to you all and Honorable Minister for Industry and Commerce to this multidisciplinary continuing education program which has been organized today, keeping in view the importance and the significance of this day. being celebrated globally as World Health Day. The theme, Healthcare in the New Millennium, is interesting and thought-provoking. The idea is to sensitize the medical scientists to pool their experience and explore the new horizons in healthcare in light of knowledge explosion and technological advances. I firmly believe that there is nothing more rewarding and satisfying than contributing to success of healthcare delivery system, being the most valuable public service in the world. Healthcare administrators must help their community to enjoy long, healthy lives. It's very important for the functionaries of the healthcare personnel to ensure the transparency in the healthcare delivery system and be open to the criticism for enacting improvements in the system. And to meet patients' needs, the health system must operate through well-trained and motivated persons. I'm a strong proponent of the philosophy that the hospital and health services should be managed by professionals qualified in the hospital administration, and they need continuing promotion by policymakers. As the management and the leadership in the healthcare involves individuals' effort to influence the behavior of others and providing direct, individualized professional care, and as such, hospital administrators remain vital to the provision of patient care in all respects. It is mandatory that professionals perceive themselves in the role of administrators and leaders and increase their knowledge by application of theory and research in their practice. Healthcare services are both specialized and very complex in each department of specialization. I believe there must be an administrator to coordinate and direct those services within and between the departments. Sir, there is a need for a three-pronged approach to government policies for improving the health. First, the government needs to foster an economic environment that enables households to improve their own health. Second, the government spending should be restricted to more cost-effective programs. And the third, government needs to promote greater diversity and competition in financing and delivery of the health services. Please, today I feel to be a very proud director when a textbook of hospital and the healthcare services administration is being released by Dr. Sheikh Mustafa Kamal, Honorable Minister for Industries and Commerce, which has been authored by one of my distinguished, young, talented, energetic faculty member, Dr. Amin, Tabish, who is an associate professor in the Department of Hospital Administration. The book is specially designed to cultivate a strong talent of multi-talented administrators to enable them to acquire broad perspectives to achieve their operational objectives and capacity to take strategic decisions. This book is a comprehensive text for planners, policymakers, administrators, and postgraduate students. It reflects latest advances in healthcare management. It also is an instructive source for teaching and to stimulate research in medical and management sciences. Dr. Tabish has distinguished himself as a writer. He has authored several textbooks. He has about 150 publications in the standard medical journals. He has remained an editor of Journal of Hospital Administration and is one of the editors of Journal of Medical Sciences being published at this institute. And has represented India in the World Health Forum held at United States of America in the year 1998. And he has the distinction of having obtained postdoctoral fellowship in epidemiology and social medicine from England. Dr. Tabish here at the Institute has been instrumental in establishing and implementing the modern concept of management of patients in the external emergency department of this institute. So has he effected some structural changes in the outpatient department to reduce the waiting time of patients attending the polyclinic. Sir, I would like to say with confidence that this institute has credentials and resolve to succeed in effective patient care management, as this organization has borne of synergy between excellence in high technology medicine and diverse and substantial experience in strategic areas. Lastly, I wish this seminar a success and hope the deliberations are fruitful. Thank you.
Thank you, sir. It is my pleasure to invite Dr. Mattoo, Vice Chairman Governing Body, to speak a few words.
Honorable Mustafa, Presidium comments. Honorable Vice Chancellor, Srinagar University of Agricultural Sciences and Technology, Mr. Director, Mr. Senior, Amin, ladies and gentlemen. So much has been spoken here before me, I find myself deficient. Hopefully deficient in what I might add to that, but nevertheless, let me, in the first place, say that it's not just enough to be a part of a function celebrating or commemorating the World Health Day, whatever it meant to its authors. I still am not clear to myself. There was, a few years back, as has been pointed out in the welcome address, when they claimed to give health to all by 2000, and the slogan, that is so death. A wretched death at that. We are witnessing today re-emergence of a resistant strain of tuberculosis, malaria, added to it the scourge of AIDS, and with the gun dangling over our heads like the Damocles sword, we are going to have very, very big numbers of patients of mental ill health. With the SKIMS of monumental dimension that are smashing on the way. So much little is given to the head. And I'm afraid they won't give you more, because health is a department which takes and gives nothing to the planners, the organizers, and to the people who manage. What is therefore important for us at least, minus the WHO, repeat, minus the WHO, Because while the United Nations promised health for all by 2000, they added to the misery of the man by imposing sanctions here, there, and there, killing the innocent children, killing the pregnant mothers, killing the lactating mothers in their huge numbers. There's not much to be expected of this organization, I'm afraid. You've got to meet the challenge if you want to, at your own level. The lesser, the better. The pivotal few that are there who would give us and work to the real work culture that has been mentioned here in the welcome address. The better. The fewer, the better. I'm afraid this challenge has to be met at the local level. We have heard mention in Professor Jalal's address of the major diseases being in the third world, the developing or underdeveloped countries. Yes, they have got to be there. Why not? Because disease is directly related to poverty. Where there's poverty, there's disease. Where there's disease, there's bound to be poverty. It's a vicious circle. Very vicious circle. The United States of America, as the major donor of the United Nations, gives you carbon dioxide emissions to 25% of the world emission today. The country that has no more than 4% population of the world, yet gives you 25% of your carbon dioxide emission. Therefore, greenhouse effect, your glaciers are melting. Inshallah, we are going to have water famine right this year here in our valley, which used to abound in water once upon a time. Thanks to those big donors of the United Nations of WHO. But therefore, we need to rise to is what we can do for ourselves, by ourselves, for our people, whatever little it may be. It's going to matter so much, so very much. In the welcome address also, a point was made. Something we have gone wrong. Somewhere we have gone wrong. Yes, very wrong. We went wrong all the way. From the word go, we continue to go wrong. Institutes like this have a limited role, very limited. What matters is the primary health center at the primary level. What matters is the intermediate health care level. All that is dead. Healthcare, I'm afraid, sir, is totally paralyzed at the peripheral level. Even a case with Zukam and a small injury in the toe reports to the institute, which is unfortunate. Which wastes the time, the resources, the manpower of the institute. It was not meant for those things. It was not raised to do that. What is? What percentage of wealth is given to the healthcare? I don't blame the government. They have their problems. They have their financial crunch, as they repeatedly say. People have rights to, people have to look after their health. Malnourishment is a very big problem. We have AIDS staring us right in our face with horrendous projections made for the future. We really don't know where we are heading to. Our healthcare policies also are talking tall. Tall, tall, tall. feeling like they don't sense anymore in the field. It comes usually the pride of the profession. And we have all these big things, all things in the institute, and that's why we don't have a technical screen available to the poor naked man in the head. Even an aspirin tablet there at the right time, in the right place, he won't need your cardiothoracic surgery department. He won't ask for it. Same holds true of other diseases that come as a result of poor nutrition or bad nutrition. Likewise, those who cannot health means suffer various diseases as a result of malnutrition. Those who have the money suffer the diseases of the rich, the diabetes, hypertension, God knows what all. But therefore, the seminar needs to look in is what best can be done with the least means available, particularly with a wind to the valley, the health problems here. How best can they do that? The seminar needs to look into that and present a policy for the government and a guideline for the poor sick. I'm glad to be a witness to the release of open health. Here is it by Dr. Amin Tabish, healthcare. Glad to be a witness to it. Millennium is a long way. We have seen millennia come and go. You'll see the next millennium also. Future generations will see it go, but I'm afraid not much will happen in it. Such are the pressures of the international community, such are the demands of our own community. So low are the means available to us. Our means, natural resources, as I said, the waters, the glaciers, the forests, are dwindling fast. We may be even poorer by the time the next millennium ends. Let's not be sicker. Let's be a little more healthy. With those words, I wish all the success to the seminar, and good luck to Dr. Amin Tabish for the future. Well, I also noticed the absence of the head of the Department of Hospital Administration. You ought to be landing in the inaugural program, but for whatever reason he kept himself out, or was kept, I don't know. But he ought to have been around. He is around anyway. Thank you all.
Thank you, sir. As has been rightly said, the fault, dear Brutus, lies not in our stars, but in ourselves that we are underlaying. So we have to act on our own, for our own. To continue, let me now take the privilege of inviting our honored chief guest, Honorable Minister Dr. Mustafa Kamal, to release the book, Hospital and Health Services Administration, Principles and Practice, authored by Dr. Syed Amin Tabish and published by Oxford University Press. Dr. Tabish has already authored 6 books. May I now request the chief guest to present a memento to the author. I now invite Dr. Tabish to say a few words.
Honorable Minister, esteemed Vice Chairman, Governing Body, worthy Director, respected Dean, respected HOD Hospital Administration, galaxy of medical and scientific luminaries, ladies and gentlemen, Assalamu alaikum. I rise to express my gratitude to the patrons for considering me for this honor. This indeed adds to my responsibilities to see SKIMS grow as an island of excellence. I understand the journey is difficult and arduous, but I believe that with determination and conviction of courage, perseverance and sincerity of purpose, the mission is possible. During the 20th century of human achievement, medicine has scored tremendous successes that have demonstrated the splendor of science and the human mind. And its achievements have spared millions of fellow humans from catastrophic disease. It must be supported by a responsible populace and governing agencies who will recognize the value of scientific discoveries and apply them indiscriminately where they are needed to ease the life of human beings. Medicine and science have still a long way to go before they solve the remaining problems of the biological existence. Society, from scientist to politician, to media representative, to the man in the street, must arouse public concern and stimulate the political will to attack problems based on the assessment of their damaging effects on humanity and the environment. The medical profession needs to evolve, as it always has, to ensure that the practice of medicine remains of relevance to the society it serves. However, despite these changes, core values such as caring and compassion remain central to the practice of medicine and the profession's greatest asset. Whatever changes may occur, the relationship between doctors and society must be informed by these values and must remain at the heart of medical practice. Aks khushbu ho bikharne se na roke koi. We all have personal, professional, and social responsibility to work towards a knowledge-based society, a scientific mindset, a conceptual revolution, character building, harmony, and tranquil ambience in working. We have a responsibility of social service during peacetime and a social response in wartime to show the commitment towards meeting the health needs of the society. The future belongs to those who have the vision to boldly reach out to the farthest limits of opportunity with a passion for change. We must therefore all reach out aggressively to grasp the opportunities of the future, tempered with sensitivity to the needs of the people. With our feet firmly on the ground, we must have the vision and courage to seize the opportunities that beckon us. We should give our imagination courage, initiative, insight, and skill. There is need for greater interaction between science and society, while public needs to better understanding of the public. Let us rise to the responsibilities of the new world, a brave new world, which we can pass on to our children and their children with the knowledge that we rose to the responsibilities of new age. दून चाहे मेरी आंखों की बसीरत छीन ले, सुर्ख पर तू मैं मगर चेहरा तेरा बाकी रहे। अल्लाह ने
Thank you, sir. Now I request Vice Chairman Governing Body, Dr. Amin, to release the souvenirs. I now request the Honorable Chief Guest, Dr. Mustafa Kamal, to enlighten us with his views.
Dr. Mattoo, Vice Chairman, Srinagar Institute of Medical Sciences, Dr. Merajudin, the Director, Dr. Jalal, Dean of the Medical Faculty, Dr. Qadiri, Dr. Tabish, and Dr. Amin, members of the faculty, Dr. M.Y. Kamal, Vice Chancellor of the Srinagar University of Agriculture Sciences and Technology, postgraduate students, staff of the Institute, ladies and gentlemen. I'm very happy to be here on the occasion of seminar on healthcare in the new millennium, being observed as WHO Anniversary Day all over the world.